trimester, your baby will grow from being around 7.5 centimeters and weighing 30 grams in week 13 to around 23 centimeters and 820 grams in week 26. Or to provide a comparison, your baby will grow from the size of a lime to a banana and eventually to a whole cauliflower. Starting from week 13, your baby's face will look more human-like every day. Their ears are now in place, and their eyes have the color you'll see at birth. Up until now, their head has been outspacing their body, but now their body will grow faster. Their arms lengthen to be proportionate with their body, and they'll be able to stick their thumb in their mouth. Also, by now, all of your baby's essential organs and systems have formed. The umbilical cord is fully mature and is protected by Wurtzen's jelly, a thick substance that makes the cord slippery so it can move freely around your baby. By the way, if you're having a girl, hundreds of thousands of eggs are forming in her ovaries, your future grandchildren. Females are born with their entire lifetime supply of eggs. Their digestive system allows your baby to taste the foods you eat through the amniotic fluid. Their waste systems are working hard, with urination taking place about every 40 minutes. Since babies pee in the womb and drink their amniotic fluid, this means they also swallow their urine. Although it may sound gross, urine is sterile, so your baby is not in any harm by drinking their own pee. Ultrafine hairs called lanugo now cover your baby's body, helping to retain body heat until fat reserves are built. This hair typically falls off prior to birth. Your baby will be able to move freely in your uterus. By about week 19, you may feel this movement. It may feel like bubbles popping or a soft rolling or swirling sensation. If your placenta is attached to the front of your uterus, it may take longer to feel kicks because an anterior placenta is like an extra layer of cushioning. By week 20, your baby can hear sounds, your stomach rumbling, your heartbeat. They can even recognize your voice. Additionally, an ultrasound will be performed by week 20 to ensure that your baby's organs are developing properly. Their sex can also be identified. During week 23, billions of brain cells that direct functions like breathing and movement will develop. By week 24, the brain connections enabling the sensation of pain are wired, and babies might start to respond to your voice, lungs. Surfactant is being produced, a substance that enables the air sacs to inflate and the lungs to expand fully. Right now, they're still breathing amniotic fluid, but when they're born, they'll be ready for air thanks to this surfactant. This is why, starting from around week 20, it's not only your baby's body that undergoes major changes during the second trimester. Although your baby weighs less than a kilo, your blood volume increases to meet the demands of all the growth happening inside you, which means you will gain some additional weight. Women typically gain around 6 kilograms in their second trimester. Your body expands faster than the skin covering it, which can result in your skin tearing. The resulting scar is what we know as a stretch mark. The stretch marks won't go away, but they should gradually fade from a pink or purplish color to white and become much less noticeable. Hormones released by the placenta cause pigment-bearing cells to increase during pregnancy. As a result, you might notice a dark line down your abdomen